Dr. Asif Umar. I'm a senior consultant in Department of General and Minimal Access Surgery at SCI International Hospital, New Delhi. Today we are going to briefly discuss about anorectal disorders, which is a very common concern in large group of population, and I would say the most neglected one. Normally we get patients at a very late stage, when the disease has progressed, and at that time the treatment becomes a bit complicated. So there is a general belief among people that all causes of bleeding PR is because of hemorrhoids, which I would definitely contradict. There are various causes of bleeding PR, and the main causes are hemorrhoids or piles, as we know, or fissure or fistula, and there are many other causes also, but today I'm going to briefly discuss about the benign causes of bleeding PR. These anorectal pathologies which I have described, they are mainly caused because of chronic constipation or increased pressure during defecation, and they really can be avoided if the patient gets proper consultation from the surgeon. So what are the causes that can cause bleeding PR? Can range from simple benign causes or more complicated ones, which may even include malignancies or Crohn's disease or sexually transmitted disease. So if a patient has these symptoms of bleeding PR or pain or an abnormal discharge or a mucoid discharge or a pus discharge from the anorectal region, he should definitely see a surgeon, and normally the diagnosis is made on an OPD basis once surgeon examines the patient, and sometimes we may need other investigations also. The most common ones include the colonoscopy or an MRI, which is disease specific. For example, in piles we don't need an MRI, we just need a colonoscopy in certain group of patients, not in all patients. So the treatment of these anorectal pathologies depends upon what type of pathology you have and what is the severity of the disease. So the treatment can simply range from a lifestyle modification or surgery in some cases. And if the patient needs surgery, it is done on a daycare basis, and the patient can go home the same day. And there are various techniques, for these anorectal pathologies, the surgical techniques, and it depends upon what type of pathology you have, what is the grade, what is the severity, and for how long have you been suffering from these conditions. Is it an acute condition or a chronic condition? So that decision is only taken by the surgeon when he examines the patient. It's always good to see a surgeon whenever you find an abnormal thing happening with you. Maybe it's a bleeding PR, or you have a mucoid discharge, or you have a pus discharge around the anal canal, you have chronic constipation, you have pain during defecation, you are feeling an abnormal mass during defecation, feeling of incomplete feeling of after you defecate. So all these symptoms, if a patient is having, he should definitely see a surgeon, and the benefits are that the treatment becomes very simple. In some cases it may be a simple lifestyle modification or a simple surgery. So if the symptoms are not they're not chronic, all these pathologies can be taken care of in a very simple way, and once the patient neglects these symptoms, then the treatment becomes complicated, surgery becomes complicated. So here in SCI International Hospital, we are doing all kinds of anorectal surgeries, and we have treated a huge number of national and international patients with excellent results. We have treated patients from most of the countries, and with excellent results. So in the end, I would say that to avoid all these things, there are very simple things which you can do. The most common ones are that you have to keep yourself hydrated, you have to include a lot of fiber in your diet, and you have to avoid constipation, you have to avoid straining once you defecate. And the most important part is you have to indulge in some kind of exercise or yoga to de-stress yourself, because stress causes a lot of things. It can aggravate any condition. So thank you very much. Thanks a lot, and have a good day.